One important message is how these data from DESTINY-Breast02 fit into the larger context of T-DXd in HER2-positive metastatic breast cancer. And so I think you have to look at the other study that was presented at San Antonio this year, which was the DESTINY-Breast03 trial. And this was updated data. And DESTINY-Breast03 is comparing T-DXd versus T-DM1 in the second-line setting. So our study, DESTINY-Breast02, looked at post-T-DM1. DESTINY-Breast03, somewhat confusingly because of the numbers, actually looked at the second-line setting. And it was directly head-to-head comparison between T-DXd and T-DM1. And those data, again, we already knew that was a positive trial. They were updated with longer follow-up here at San Antonio. And those data continue to look very impressive. So now with longer follow-up, the DESTINY-Breast03 trial shows a 4-fold improvement in progression-free survival with T-DXd over T-DM1. So 28-month median PFS compared to about 7 months with the T-DM1. So huge difference. Overall survival in that study is now statistically significant as well. So I think the further updated data from DESTINY-Breast03 in the second line really are unequivocally, dramatically positive, if you don't mind me throwing in a couple, extra adjectives. I think that in the clinic, that means we really should be using T-DXd in the second line to take advantage of this, really impressive, very long responses, very long disease control in that setting. And the fact that T-DXd also works in later lines is certainly good news, but I think it becomes less clinically relevant over time because most patients should be getting the drug in the second line. If you have a patient who has already received T-DM1 and hasn't received T-DXd yet, then the DESTINY-Breast02 data certainly show that T-DXd is very active in that situation and should be used, but that population is going to get smaller and smaller, and really T-DXd should be used in the second line.